Bienvenidos al tercer episodio de nuestra nueva serie.
Welcome to our third episode of our new series, Leaders of the America. The purpose of this initiative is to summon the top leaders throughout Latin America so we can discuss the most important topics for the region. Today, we have President of Guatemala, Alejandro Giammattei. Mr. President, welcome. Mr. Giammattei is joined by the Minister of Foreign Affairs, Culo, and the Ambassador Quiñones. We already had the President of Colombia, Iván Duque, and we had the Venezuelan interim president, Mr. Guaido. Today, we have President Giammattei. We will be talking about the COVID-19 response and Mr. Giammattei's plans to reactivate the Guatemalan economy. We salute you, Mr. President, and I would like now to give the floor to Ana Palacio, Atlanta Council Board member and former Foreign Affairs Minister of Spain. Ana. Thank you very much, Jason. I'd like to say that this is a special honor to welcome Dr. Alejandro Giammattei, President of the Republic of Guatemala, because I had the honor of meeting him and holding an extremely interesting conversation when he was just starting his administration back in January. It seems such a long time ago, only it's a few months ago. And I acknowledged both his commitment to Guatemala and his strategic vision. I'm going to call you Dr. Giammattei because President Giammattei gathers large expertise. He's a physician, he's a doctor, and this gives us, it conveys both safety and security. And he has local experience. He has been a director of the Guatemalan penitentiary system, and he has always also worked in the private sector. And there is no way of thriving in this situation without a public-private partnership. So we have a high-quality leader in a key region. I would like to share an anecdote, if you may. After having that conversation with President Giammattei, I thought it was so interesting that I stopped on my way back to Spain in Washington to meet Jason Marjak and Maria Fernanda Perez from the Atlanta Council, and we had a conversation. I told them that there was an extremely interesting individual leading Guatemala, and I was particularly impressed by his clear language, by his infectious energy, Mr. President, as well as his great realistic ambition. And when we see that in rulers, it's an exception. It's not necessarily a common thing. It's a great pleasure to be here, and I give the floor back to Jason Marjak. I'm convinced that we will have an extremely interesting conversation. Thank you very much, Jason. Thank you, Ana. Mr. President, I would like to start out this conversation. You became president by having a plan to reactivate the economy and to fight corruption, among other priorities. 2 months in, Guatemala saw the first case of coronavirus with major effects on the economy and different economic sectors. Guatemala has over 2,200 confirmed coronavirus cases, and you've been adamant as a physician about how important it is to protect Guatemalan lives. The first question is, which factors have been the key factors you've contemplated in establishing the national quarantine and other coronavirus fighting mechanisms, including full lockdown over the past weekend in the country? Thank you very much First, Ana Palacio, thank you. Thank you very much for sharing the story about how we met. And, you know, it wasn't you who was impressed after that meeting. I was impressed. It was day 49 into my administration when the first case of coronavirus appeared. So only 49 days had passed, and we were barely trying to get our administration set when the first case appeared. And throughout these 128 days we've been in office, Ana is just said that I'm full of energy. And you know what? After 128 days of government, I barely have energy, you know? But we have managed to recover and to revitalize certain economic areas. We must say that extortions have gone down. We've been able to fight corruption in sectors because we are narrowing down criminals in certain municipalities. So there has been major impact to that regard. And we were working on that. We were doing that when the coronavirus appeared. The first measure was taken on February the 3rd, not on March the 3rd. We started on February the 3rd. We declared, well, the WHO declared that 7 countries in the Americas had confirmed cases, and we saw what was happening in China and Korea. And, you know, we asked the airlines to stop. We didn't want any case in Guatemala. Nonetheless, the first case appeared on March the 3rd, although we had already started with our 3-phase protocol. Phase 1 aimed for protection. And the protocols back then were only focused on 2 phases, protection and mitigation, but we added an intermediate phase, and we called it contention, the contention phase. So it was not only preventing the entrance of the virus, which we were already doing, but we also focused on contention. And we knew that we were going to get hit hard because our healthcare system had been fully neglected for 40 to 50 years. And the bed average as per 1,000 inhabitants was 0.6. We had a very low number of respirators, and most of them weren't working. And we know that the acute phase of the disease requires respiratory assistance. Today, we've rebuilt 4 hospitals. We're already working on the 5th hospital, and we're also analyzing how to start building the 6th hospital. So we're providing coverage for most of the population. Other countries, we're telling patients, okay, you just tested positive, go back home. And when they went back home, they infected everybody else in the household. We didn't do that. We did it the other way around. We knew that we had a few hospitals, and the contention phase should be strong. So all positive tested patients were sent to a hospital. We didn't send them back home. The social security system, the social security hospitals of Guatemala did not abide by our protocol. They sent everybody back home, and that's why the disease has increased over the last weeks. And right now, it's compulsory for all institutions that whenever there's a positive case, they should go to a hospital. Why? Because 1, we will reduce contact. All over the world, when you tell patients and you'll go back home and isolate yourself, well, perhaps it's feasible to do that, but what about Guatemala? In other countries in the first world, everybody has their own room, you know, at home. But in Guatemala, we're talking about a country where 60 to 70% of the population lives in poverty, and a house only has 1 or 2 rooms for the whole family. So you cannot demand isolation at home. Right now, we just opened up the second hotel with healthcare services, and we're sending people there. We're trying to establish a fairly conservative protocol to release coronavirus patients. In the days to come, around 80 to 100 patients will be released. Because we took a while to release our patients because we want to be sure they're really cured. We don't want to be relapse. We don't want to see these patients, released into the country without being sure that they're absolutely cured. In our case, yesterday in the Parque de la Industria Hospital, where we have a great intensive care unit, there are only 8 patients with ventilators, and none of them were at risk of death, but they did require assisted ventilation. So we've managed this crisis with treatments. We started 5 weeks ago giving anticoagulants to patients. So although patients may be asymptomatic, if they've tested positive, we will not only give them paracetamol, but we will also give them 100 grams of aspirin on a daily basis to prevent thrombosis, because there are thrombus that go into the lungs, and microthrombi generate the problems that end up ending with patients' lives. Thank you. Thank you very much, Mr. President. I believe the lessons we can learn from Guatemala and the steps you've taken are significant, and we could share this information with other countries because you have a dedicated plan. I would like to ask you about the economy and the reactivation of economy in the month of March. And I would also like to remind participants that if you have any questions, you can activate the Zoom Q&A feature, or you can also do it via Twitter. In terms of economic reactivation, can you share your extremely complex plan to balance the recovery and reactivation of the economy as the public crisis continues, and now that remittances from the United States are lowered due to the virus, so the Guatemalan budget is altogether reduced? I would like you to share your plans and to share your vision into the future about how things may change in the commodities chain. What can you tell us about the Guatemalan economy's reactivation? Thank you very much. We have all ongoing protocols for all the different activities, starting with the spiritual aspects, the churches, all lines of thought, churches are now open, and we have also a plan for soccer. So, I would like to emphasize on the fact that all protocols are different, because you cannot have the same protocol for trade, for the industry, for construction. And also within the industry, there is a certain classification. So we are ready to disclose the protocols, because you should know that if I ever go to a shopping mall, I need to clearly understand both my rights and obligations inside that mall. And the retail sector must also be acquainted with their rights and obligations. And Jason, we must underscore that we will have to get used to the disease, and we will have to get used to the fact, it's like the Monaco F1 race, okay? And in Formula One, you need two things. You need how to step the gas and to stop the brake. And so, why am I setting out this analogy with the disease? You know, if we open a given activity, the disease will spike. And we need a protocol to address that specific spike. We need to try to flatten the curve all the time because it's unlikely that cases won't go up. Because if you open up public transportation, of course, we will have more cases. So we need to open the economy up with protocols, with restrictions, with a detailed plan. And if the peak of the disease is not on its highest, we need to step on the gas to reactivate the economy. And that's why we have to act in clusters. It's like you shut down a neighborhood, a municipality, a state, or a province, but in phases. It has to be a phased approach. You must only close one municipality up without closing the rest of the country. But in order to do that, first our population needed to be aware of the risks. You know, a few months ago, nobody in the country actually believed the severity of the disease. But Guatemala was one of the first countries in the world where a mouthpiece or where a mask became mandatory. You know, it was a ruling, it was a decree, and everybody followed it. After that, the WHO established that masks were mandatory, you know, and everybody then who had thought that I was exaggerating really knew that I was right. And, you know, for the next 2 or 3 years, everybody's going to have to get used to wearing a mask. And we need to give wings to the private sector as well. You know, the first thing we're thinking about doing in Guatemala is to reactivate the construction sector. When? Well, perhaps in a week or two. And why? Because within the broad range of economic activities, the construction sector entails the largest social isolation. You know, you have one individual over there working on the bricks, and you have somebody else working on the wires. So there is social isolation inside the construction sector. This is why we sent a bill to Congress to work in different entities, and we just filed for a $1 billion loan to rebuild the economy, you know. And you must also remember that Guatemala was an extremely covered country, and we, as government, we have to rent most of the facilities we use. So we just filed for this loan because we want to buy the facilities, and if we do that, we will generate 300,000 or 350,000 new employment, thus reducing rental expenditures and increasing production. Mr. President, I have 2 more questions because I would like to clearly understand your plans to fight corruption. So I would like you to share your administration's project to fight corruption, and I will also ask you another question about the United States when we come back. Well, let me tell you that the government's technological capacity has increased because we need technology to reduce discretionality. We have given 6 billion in quetzals to 2 million families. We're giving them 1,500 quetzals to these families, and 10 million people are beneficiaries of this plan. And there's also a subsidized for energy consumption according to consumption. And those in 9% of the population is also receiving food directly at home because there's no other way to do it. So based on the utilities bill and their personal ID, they can go to an ATM or to a bank to make a withdrawal. And it is not a partisan affair. We're addressing everybody. Everybody is part of this program. There's full coverage, and we have actually created social programs to assist the population without even having human intervention, therefore reducing public officials' discretionality. So that's how we're fighting corruption as well. And we're also doing it in small villages and small towns. We don't want human beings involved in that. We are creating automated systems. In some occasions, that's how you have to act. Mr. President, I have another question about the United States, but hold on a sec. Let me share about what we've done about imports and exports. Yes, precisely. That's why I was going to ask you about the United States, because the United States is a major Guatemalan ally. And I have two questions. Number one, what role may the United States play amidst the crisis? And there's another question about migrants. Many migrants have been deported back to Guatemala from the U.S., and some of them have tested positive. So this is a question about the role of the United States and the future of migratory cooperation. Allies of the United States? That's not true. I believe that Guatemala is an ally to the United States, but I don't believe that the United States is an ally to Guatemala because they don't treat us as such. We've seen how the United States has assisted other countries with respirators, for instance, and you know what? We haven't even gotten from them a dime. We are allies to the United States, but I don't think it's reciprocal. We don't think that it's a two-way road. We don't feel appreciative of how we've been treated. Yes, indeed, we've had serious issues with deported individuals, and I'm not going to delve into the details because I believe that it would even be anti-diplomatic if we shared the details right now, but I can say adamantly that we have not been treated with goodness by the United States amidst the crisis. We do understand that the United States wants to have less people in their nation, but why are they only sending the infected patients? Because, we now have to treat a disease that wasn't created here, but our hospitals, which are limited, are now having to deal with these patients. We don't have enough room for quarantine patients. So if there were 75 positive patients, just by having 3 immigrants back, it's like a full expansion and dissemination of the disease. So having such a large amount of patients in our hospitals right now, it's such a burden because not even one mask. We haven't even received one single mask from the United States. Well, the ones they carry with them when they come back. So we do consider ourselves and we behave as allies to the United States, but we would like reciprocity. Okay, send the immigrants back. Okay, there are a problem, but you're sending them with a disease. So let's share that part of the problem. And we would also like to tighten our relationship with the United States because there are protocols. The CDC delegates in Guatemala drafted the protocols with us. And, there's been full compliance on our side, but not on the other side. Thank you very much, Mr. President, for that question. And I have a question from Edward Villanueva from the United States Council to promote the Guatemala-United States bilateral agenda. He has a question about moving United States investments and supply activities in Guatemala. The question is if you can share if the Guatemalan government already started plans to attract further U.S. investment to Guatemala, and if the answer to that question is yes, how can you guarantee stability to foreign investment at the time being? Thank you very much, Jason. There's a one-stop shop both for imports and exports to reduce red tape and to facilitate trade. It's a one-stop shop, and everything is handled there. We already started the construction refurbishing plans of the San Jose airport. It's the first cargo airport in the region. And this airport, in addition to having a military base, will hold a duty-free area to process whatever is required so we can work in the port, because it will be both a one-stop shop and an airport at the same place. And added efforts are required. That's why we are in communication with the United States, because we would like to have U.S. Customs delegates in Guatemala so everything is cleared when it leaves the country, Guatemala. If there are fruits or vegetables leaving Guatemala, it would be great if they are cleared as they leave, passing sanitary controls and safety controls. I think it would enable commerce. It would indeed be a novelty. And of course, we will be able to draw further American investment because we are currently exploring the southern coastline. We have to create the new Champelingo port. So we want the Champelingo port reactivated with a multi-node development in the southern coast of Guatemala, so where we can have airports, trains, duty-free areas all in one in order to further boost investment. We believe that Guatemala, as I just said, is inviting U.S. companies. They left to China, and we want them back because it's cheaper here. I think that we're closer, we're cheaper in our proposal to the United States to jointly work on a gas line that will make a bridge between the Atlantic and the Pacific. So since there's an altitude disparity, it would be great to facilitate. I think that instead of traveling the world, which takes 28 days, ships may cross this area. It would be great to do it alongside the United States, and alongside Central America, because this is an extremely important region. There are over 50 million people. This region also has a canal. We could also have a gas line. So if there was true integration, if we really became one solid economic bloc that would attract investment and facilitate transit and taxes, just like the European Union does, if we brought down borders and customs and inspections, we would be able to further exploit natural resources. It could further exploit the marvelous labor in Central America. And we're 2 hours, 20 minutes away from Miami.
Señor Presidente, espero cuando yo pueda viajar a Guatemala de vuelta, eso solamente.
I hope when I go back to Guatemala, it'll be soon. It's a 2-hour flight. Allow me to finish and to thank you, sir, for your time on behalf of the Atlantic Council, of the founder of Central America. Madam Adrienne Harsh has been part of this discussion, a very important discussion. Thank you so much for your efforts, and thanks to her efforts, we're here today. Allow me to convey our solidarity from the Center for Latin America, Adrienne Harsh, and definitely we've felt that economic prosperity is crucial in Guatemala and all of Central America, and you definitely continue having our support. Once again, thank you very much, Mr. President, for your time, and we shall continue being in touch. Thank you.